My name is Nick Sprague. I am a stage 4A colorectal fighter, I guess. I won't call myself a survivor yet until I beat it, but I am a warrior. I'm married. I've been married to my wife for almost 6 years this year. We've been together way longer than that. We have a wonderful 28-year-old daughter that lives on the other side of the state. My wife and I live in Chippewa Falls, Wisconsin. I've been out this way in the States for probably almost 15 years. I am a full-time firefighter, critical care paramedic. I've been doing firefighting for about 16 years and paramedicine for about 13 of those 16 years. Symptoms started a year or two before diagnosis. It started with a change in bowel habits, size, consistency, some blood in the stool, abdominal pain, kind of some acid reflux type reactions that my wife and I chalked up to aging, maybe being not as healthy as I could be at my age. My wife having IBS, I thought some of it was IBS. Some foods would just trigger some reactions in me. Fast forward now a couple years, I was working full-time for a department for about a decade, decided to change over to a neighboring department full-time. And for these jobs, we have to pass a physical agility test to get off our probation. Had been working myself, daily workouts. That test is a pretty rigorous test to be able to do what we do. And at my age, I was 48. I wasn't one of the 20-year-olds that we're usually hiring. So I was kind of doing this at an older age than most. So I was in pretty good shape. Had passed that at the age just 2 weeks before my 48th birthday. Couple months later, we're on shift. We respond to a house fire. We work that. My battalion chief at some point pulled me off the line, said, you look wiped out. I'm gonna sit you out here for a little bit, catch your breath. And I'm like, okay, I feel a little tired, but again, I'm not 20 something. I am getting a little older. All right, whatever. Sat out, went back in for another round with a fresh bottle on this fire, did my gig. And then this time the chief was there on scene and said, Nick, take your gear off. You don't look good. Go back to the ambulance. You're going to be doing rehab, making sure everyone else is doing okay, but we don't want you going back in. And I'm like, well, okay, something's weird. Maybe I'm not hydrated enough or whatever. But apparently I didn't look healthy to my chiefs. Call my wife, say, meet me in the ER. I don't know what's going on. I've got really bad abdominal pain. I haven't slept. I'm going to go get checked out. Long story short there, which I make all long stories long. I was diagnosed in the ER with diverticulitis and sepsis. They started me on antibiotics right away. They weren't sure if surgery was going to be necessary, but then they set up transfer to the hospital I was at the night before with a patient on an interfacility transfer. So shipped me down there. My brothers and sisters came and picked me up in the ambulance, and that was great. Having my coworkers transport me as a patient, which has never happened in my life and hope they never would. At that point, I'm stable, get dropped off at the hospital, I think we met with a surgeon, a thoracic abdominal GI surgeon, and started to realize things were kind of serious. But he said, we're not going to go in right away. We're going to kind of keep an eye on you tonight. Hopefully things will subside with some more antibiotics. Some steroids if we have to, but we're gonna keep an eye on you and evaluate you. We'd really like to avoid surgery. Next day, I wake up, get my vitals by the nurses, and they said, "Oh, we see you're slated for surgery." And I'm like, "Oh, okay, guess we're going in for surgery." That turned into a laparoscopic washout. They had found I had a perforated colon, perforated colon in the sigmoid area. The last area right before the rectum, but that had healed itself. So basically they went in, a couple small incisions, washed everything out to make sure there was no fecal matter in there, no infection, kind of stitched me back up. Couple of surgical drains. I was in the hospital for 5, 6 days, I think, and sent home to heal up and get better and hopefully get back to working on with my life again. Ended up getting readmitted a couple days and went to the local hospital again where I live. I had some drainage coming from my drain sites, and they found I had an abscess after a CT post-op. Another infection, send me down. E. coli, I believe, was one of the culprits, and there was something else in there. So now they needed some heavy hitter antibiotics. Went back to work light duty, where I worked shifts, but I couldn't go on calls. And about another 2 weeks, antibiotics, PICC line was pulled. Met with the surgeon, everything's great. Let's do a follow-up colonoscopy to check how the diverticulitis is. I'm like, I want to sleep through it, but I didn't. I felt great. So I go in, do it, and you can see the screen the whole time. And I'm joking with the nurses and the docs. We're all relaxed. I hate to say it, we're having a good time. And all of a sudden, I heard the doctors say, "That's not good." I remember seeing the screen and seeing a black mass. And then he tried advancing past it. And I said, "Ow." And when you're on fentanyl and Versed, the fentanyl kind of takes away any pain. The Versed, if you are experiencing pain, kind of makes you not feel it or not realize it. Your brain will recognize it, but you don't really feel it. So I said, "Ow," but I didn't feel it. And he's like, "Okay, we're backing out." And I'm like, "No, keep going." And he's like, "No, you said it hurt. We can't get past this mass. We're gonna pull out." And the tone changed. I mean, it went from we are all smiling, having a good time to you probably could have heard a needle drop in that procedure room. They wheeled me back into the recovery room where my wife was waiting. On the way there, one of the nurses handed me a polished stone that said "Hope" stamped on it. I didn't think that choked me up, but carry it wherever I go. Yet, in hindsight, it meant a lot. And it drove home the seriousness now of we don't know exactly what's going on, but something's not right. And I'm only a paramedic, but there's enough medical training and enough field experience out there to go, I'm reading the room, this isn't good. Doctor eventually came back in, said we can't diagnose it yet. They did take a small biopsy at that point, and they were going to send that off for testing to confirm what they thought it was. He wouldn't say it was cancer, yes or no. But they said, "Hey, we're going to send it off." Got the results. Finally, they came in. Got the ding on the notification on my phone. Checked it, and it stated that it was adenocarcinoma. It was probably malignant, and didn't want to tell the wife, but I did. Finally called her. Now we know what we're dealing with, sort of. All right, it's cancer of some sort. Never thought it in the world. The day of the colonoscopy, and we were in the procedure room afterwards, he said, we're going to have surgery. It has to come out, whatever it is. So he referred me to surgery right away. And of course, we're getting closer to the holidays at this point, because I think that was November 17th was the colonoscopy. And I think when I kind of consider it my cancerversary, not knowing what it was, but we knew it was cancer. Luckily, it was the same surgeon that had performed my surgery earlier in the summer, who I trust with my life. The guy's a rock star. Just did an amazing job back then. And I'm like, okay, good. I got this guy again. We can tackle it. Met with him about a week later, right before Thanksgiving, I think it was. Kind of explained it was going to be more of an exploratory surgery until they knew exactly what it was in there, and then we do our thing. I remember being in the room with my mother-in-law came out too, and my wife was there, of course. They wheeled me in, did their IVs, said, Mr. Sprague, hey, start counting back from 100. I don't think I hit 99. 5 hours later, I woke up with a slightly sore throat in my hospital room. They had performed a sigmoid resection. I can't remember how much colon they took out, but it did not require an ostomy, thankfully. They were able to resect it and reconnect it right away. The good news was they got the tumor. The margins were all clear, so they felt it hadn't spread far, at least in the tissue of the colon. But the surgeon did tell us also that they've sampled some lymph nodes right next to the tumor site, and they took out 49, 19 of which tested positive for cancer. At that point, referred to oncology. Met with my oncology team right before Christmas, I believe. Met with Dr. Lalich, was my oncologist, and what really helped is his nurse was a former ER nurse I was familiar with, so to see a familiar face in that room, it went a long way. Kind of said what he planned on doing based on the CTs. They had seen some inflammation in some other lymph nodes. They weren't sure if that was just post-surgical or what. They do another CT to check things out on their own. But they were happy about the margins being clear on the resection and very positive, diagnosed stage 3C colon cancer. It metastasized a little bit past the point of origin, but not very far. Went and had Christmas with family again across the state, came back. It was going to be, I believe, like first day of chemo was going to include labs and a CT just to see where we're at. And the plan was to do chemo, Capox, which is capecitabine, an oral medication, and oxaliplatin, which is an IV medication. I called oxaliplatin the artillery. That was the one that probably caused the worst side effects, but it's also the one that can be very, very effective against this cancer. So it was kind of like, whatever, I'll take the side effects if we can knock this out. And it was capecitabine twice a day. God, I think for me, because it's weight-based, it was like at least 4 pills in the morning, 4 pills in the evening, and they were not small pills. And then I would do the oral chemo for 2 weeks, and then at the 3rd week I could stop the oral. I would go in for the IV chemo, and then that was also based on weight, but that was a longer infusion. They would do labs those days to make sure everything was okay, and then they wanted the initial CT to get a baseline again. Unfortunately, the doc didn't like what he saw in the CT. He saw some more inflammation in some lymph nodes, and said, I want to get a better handle on this. We're going to get something a little more defined, and set me up for a PET scan. Within a few days, I think it was, or within 5 days. All right, we'll delay the chemo. Went on, I think, a Saturday for the PET scan, where basically they start an IV, shoot you up with some radiated sugar water, and then put you in an even fancier CT machine. And what that does is supposed to light up the spots where the cancer is believed to be the spots of inflammation. Got that done, easy peasy, went home. And I think a couple of days later, then we came back to try and start chemo again and get the PET scan read. And the doc confirmed it with our next appointment. It had spread to lymph nodes, kind of down in the abdominal area, some lymph nodes very tight along my aorta, all the way up into my left shoulder. So it had spread a lot further than we thought it had, which, all right, let's just keep building on the bad news for 2022, not that I'm looking for a pity story here, but it's like, I felt like every time we were like made a plan to move forward, we're getting kicked back a couple steps again, but stayed positive. I wanted to, I had to for my family. That's the whole reason I'm in this fight is for my family. My true belief is someday, yeah, this cancer will get me. But I'm not going down without a fight, and it's going to be a long, drug out fight. So I'm stubborn. I'm from Wisconsin, Bohemian, German. We don't go down without swinging. So we started chemo, and I'm not gonna lie, the chemo wasn't fun. It knocks the heck out of you. Fatigue for sure within the first day. Um, I believe it's the oxaliplatin. You can't drink for probably a week and a half right when you start getting the infusion. You can't drink cold drinks. It feels like glass shards that you're swallowing. And they described it to me. I didn't believe them. I'm like, what? Who knows what glass shards going down your throat is, right? And that's what it is. A lot of fatigue, neuropathy kicked in. Um, I've had patients that describe it, as pins and needles in their hands. But I've never experienced it, so I couldn't tell you. But yeah, it's an odd sensation. My toes, my feet, my hands. We get winters here in Wisconsin, and I didn't like being out in the cold, and I love ice fishing. You'll catch me outside at 20 below on a normal day, but chemo, not a chance. I couldn't be in. I had to be bundled all the time. Eye pain. My eyes were always drying out, so they hurt a lot. Insomnia, joint pain, muscle pain, you name it, we had it. We added Avastin, which is an immunotherapy, to the chemo routine. That caused a really bad acne rash to my back, but just my back, but from the waistline all the way up to my neck. The doctor had never seen it, never heard of it, but that's the only thing we can attribute it to is the Avastin. That was the only thing that changed when that started. Felt like I was in high school again. Just a bunch of pimples all over. Not painful, but there. Just a little demoralizing, but whatever. We got through it. A lot of, I think the initial plan was going to be for 6 months, 8 cycles of chemo and Avastin. Unfortunately, because of the restaging, it was going to be more of a you're going to be on treatment for the rest of your life. You might get some time off if we get no evidence of disease at any point, but it will come back at some point, and we'll have to continue treatment. So we continued on with that. I was able to work full time, back on full duty as a firefighter. I tried to time my infusions we get an extended weekend through our swing, so it's a 4-day weekend for us. I tried to time it there, so I had a couple days to recover post infusion and feel somewhat human going back to work. Work was very accommodating. We're firefighters, we don't sleep all day, but the chief said, hey, if you got to rest, go to your dorm, let us know. There's no fault. Which I appreciate, and I never ever took them up on it. I tried to stay right there with my brothers and sisters training or doing whatever we're doing on calls. And that was working great. My CEA, my tumor marker, was through the roof when this all started at like 175, whatever the measurement is, but the number was like 175, and it was dropping with the chemo. We were seeing shrinkage with the lymph nodes. We're like, okay, this is awesome. Sucks, but it's doing what it's doing. So we stayed very positive. And then we got to about cycle 6, I think. And we noticed my CEA was going back up a little bit. But with that, we would do every 3 months, we were doing CT, I think. We also noticed some growth again in the lymph nodes. And the doc said, all right, we're gonna stop the chemo. It's not working. The oxaliplatin, you can only receive so much of it before it will be completely ineffective. And he said, this saves us a couple of cycles where if we need to go back to it, we can go back to it. So we're going to switch over to an immunotherapy called Keytruda. The side effects are supposed to be much less than chemo. I'm like, well, I'm all for that. I'm still, I mean, I think I quit chemo in probably around August of last year, which would be 23, and started up around September or maybe later in August. Here we are in 2024, almost June, And I still have very slight neuropathy every now and then in my toes and my fingertips. Nothing, debilitating, but just a reminder that I was on chemo at one point. And that probably won't get any better or any worse, hopefully. That went well. With the Keytruda, didn't have to worry about that so much. And that's a half-hour infusion as opposed to slowing that rate. That was a 5-6 hour day at the hospital. Now I go get labs drawn, sit and wait a little bit, and it's a half-hour infusion, and boom, I'm on my way home. If I go at 7:30 in the morning for labs, I'm home by 10 or 11 o'clock, which is great. Side effects are minimal. We want to do the Keytruda for about 18 more months. It's a 2-year plan, see what it does, and go from there. Hopefully the response brings everything down to normal levels, no evidence of anything, and I can ride that out for a while. Fingers crossed. Maybe Keytruda is the fix for colon cancer. I don't know. But realistically, I don't think so. I think it'll be a lifetime battle, but it's going to be a long life. So with the support of my family, my work family, my friends, I couldn't do it without them, but they're my rock. They're what gets me through this. Scanxiety is a real thing. Um, as a paramedic, I've dealt with patients with panic attacks and anxiety, and I'm going to admit, and this probably makes me a bad paramedic, and my instructors from years ago will probably be like, "We told you." Um, Anxiety is a real thing. Um, a lot of times it doesn't seem like it with the patients you're dealing with, but now that I'm put in that position, it's a real thing. I've dealt with it, luckily, with a great support group in place even before cancer, through another set of unfortunate circumstances. We see a lot of things in this business as paramedics and firefighters. So after a while, you start to realize things aren't normal. And I had to start paying attention to my mental health closer, to the point where I was threatened. The marriage isn't going to last if I don't do something about it. And there's a few calls in my career I can look back that probably were triggering some things. So I started seeing a therapist, and had a great relationship with her now for years. She's really taught me how to deal with stress, deal with anxiety, deal with my feelings. This stuff is real. And to bring it back to cancer, thankfully she was there already lined up for me. So that helped. But outside of that, the anxiety is real. All I can really tell you to deal with it is stay strong. Recognize that the stress is real. What we're going through as cancer patients is not something most people go through, nor do they understand. So take a deep breath, listen to what your mind and your body are telling you, and know that those feelings are valid. Don't try and brush it off and be strong and push your way through it. Rely on that support team. If you have a therapist, talk to that therapist. Most oncology teams come with a social worker. Use that social worker and that resource. Rely on your family for strength. Tell your spouse, what you're feeling, even when you don't want to. Sometimes talking about it gets it out there and puts it away, as opposed to having it here weighing you down. I find just spending time retreating to home, retreating to family, or going to work, and staying busy with work, making sure that some of those students that I helped raise at the technical college that we've hired now as full-time brothers and sisters are doing their thing. Then hopefully they're keeping me in check too at work, but keeping busy. Hobbies, rely on your hobbies if you have any. If you don't, find some. I'm a big fisherman. I love fishing. You could put me on a lake and I could not catch a fish for days and I would be in my happy place. So just find something that helps you disconnect even from the cancer stuff you're going through. It is for anyone that might be experiencing some sort of symptoms that they're not quite sure what they are. Listen to your body, go talk to your doctor, be an advocate for yourself. If you feel something's not right, push for tests, push to try and figure out what's going on and get answers. The answer of "we don't know what's wrong with you" is not acceptable. Push to find that answer. That's what those doctors are there for. My second message is for those cancer patients, those survivors, those warriors that are out there going through this. Keep going. You're not in it alone. There are support groups out there beyond family, beyond friends, beyond coworkers. There are a ton of support groups out there online, on Facebook, social workers, whatever. It's there. There's all kinds of stuff out there, and no, you're not in this alone. It may feel like it some days. There are some days I get down in the dumps, I get low, and I find something to get me back up. I come up with a reason to keep going, and there are a million reasons to keep going. But if you find one, that's all it takes to keep going.